What if the most addictive thing in the world isn't a substance but a behavior? This question opens up the intricate puzzle of addiction. Addiction is a term often associated with substances, yet it encompasses much more. It's a broad concept with two main aspects, the psychological and the physiological. Imagine this: the allure of the aromatic brew of your morning cup of coffee, the compulsive need to check your smartphone for updates, or the incessant drive to work far beyond your capacity. These are examples of socially acceptable addictions, which may seem harmless but can have profound effects on our lives. The psychological aspect of addiction refers to the mental and emotional processes that lead to and perpetuate addictive behaviors. The physiological aspect, on the other hand, involves the physical changes in the body that result from these behaviors. Understanding the two faces of addiction, the psychological and physiological, offers a clearer picture of this complex issue. Addiction doesn't just happen, it begins in the mind. Indeed, the roots of addiction often lie deep within our psychological landscape, tangled in a complex web of emotional needs and desires. Imagine a tree, its branches reaching out for the sun, symbolizing our basic emotional needs: comfort, relief from stress, the desire for reward. Just as the tree reaches for sunlight, we too reach out to fulfill these needs. One might ask, but how does fulfilling emotional needs lead to addiction? Well, it's not the need itself that's the issue, but rather the methods we choose to satisfy these needs. When we repeatedly turn to substances or behaviors to find comfort, to escape stress, or to reward ourselves, we're essentially training our brain to associate these substances or behaviors with the fulfillment of our emotional needs. Over time, this association grows stronger, creating a pattern of addictive behavior. It's like a path in a forest. The more you walk on it, the clearer and more defined it becomes. It's a cycle, a loop that's hard to break because it's etched deep into our neural pathways. The real kicker: our brain is designed to reward us when we fulfill our needs. It releases dopamine, a neurotransmitter that makes us feel good. This feel-good factor strengthens the association, further fueling the cycle of addiction. So, addiction is not just a bad habit, it's a psychological response to unmet needs. But addiction isn't just about what's happening in our minds. It's also about what's happening in our bodies. Dive into the physiological aspect of addiction, and you'll discover fascinating yet alarming changes occurring within the brain. With repeated exposure to addictive substances or behaviors, our brain's structure and function can alter drastically. This isn't a mere metaphor. It's real, visible transformation, a testament to the power of addiction. Imagine your brain as a city with well-planned pathways. Now, think of addiction as a construction crew, eagerly building a superhighway towards the reward center. This is the part of the brain that lights up with feel-good chemicals like dopamine each time we engage in an addictive behavior. Over time, this superhighway becomes the preferred route, changing your brain's traffic flow. This is the physical dependence, the compelling need to keep going back to the addictive behavior or substance. And while it's easy to associate this primarily with substance abuse, drugs, alcohol, nicotine, it's important to realize that behavioral addictions also leave their mark. Excessive gaming, overeating, compulsive shopping, they all remodel the brain's landscape in similar ways. These are socially acceptable addictions, but their impact on the brain's structure and function is no less profound. So, addiction is a dance between the mind and the body, each influencing and responding to the other. So, what have we learned about addiction? We've taken a deep dive into the maze that is addiction, unpacking its dimensions from the psychological to the physiological. We've seen how addiction is not a simple bad habit, but a complex issue that intertwines our minds and bodies. From the psychological perspective, we've learned that addiction often stems from our mind's attempt to cope with stress, anxiety, and other emotional discomforts. It's a form of escape, a temporary relief from the burdens that weigh us down. Switching gears to the physiological side, we've learned how addictive substances can hijack our brains, altering our reward systems and driving us to crave more of the substance. We've also shed light on the fact that addiction isn't restricted to illicit substances, but can also stem from socially acceptable activities, including work, shopping, and the use of technology. Remember, understanding is the first step towards change. If you found this video informative, hit that like button and subscribe to our channel for more insightful content.